Great. So it looks like we're coming up on the top of the hour here. I just want to thank all of the Stony Brook students for signing up and attending. I'm going to let you guys keep rolling in as you are transitioning to your lunch break. My name is Miles Murphy. I am going to introduce myself, and then I'm going to let Dr. Don Helfer introduce himself. So my name is Miles Murphy. I am the Academic and Industry Relations Manager here at Aspen Dental Management. And this is a Ask Me Anything session with Dr. Helfer, which it is pretty much how it sounds, is a Ask Me Anything. So feel free to ask any questions that you guys have. There is a Q&A box on the bottom of your screen. So whatever questions you have that come top of mind, feel free to type those in and we will be answering them as they come in live. Just want to let you all know that if I'm looking to my other screen, it just means that I am currently looking at the questions that are coming in and relaying them to Dr. Helfer. I will also be circling back as well to the questions that you have submitted when you signed up. So you were given the opportunity to sign up to submit the questions when you signed up. So I have some of the questions from the students as well that submitted the questions beforehand. So we will be circling back to those as well. I also want to point out that Aspen Dental, we are also offering free CE courses on aspendentalce.com/welcome. So all you have to do is go into that website and sign up, and then you'll be good to go from there. So without further ado, I am going to open up the floor to Dr. Helfer and let him introduce himself, and then we'll jump into some of these questions. Thank you again, students.
All right, thank you, Miles. Hello, everyone, and thank you so much for welcoming us today to talk with you. I'm very excited to share my story and share the story of Aspen Dental, really answer any questions that you might have. My title here is Director of Clinical Support. I report to Dr. Arvinder Judge, who is our Chief Clinical Officer, and he reports to our Chief Executive Officer, Bob Fontana, and our founder. So our role is really to make sure that the doctors have all support that they need when they're in the field to be successful and to reach their goals. I'm an Indiana University graduate. I worked there as a professor on the clinic floor. I've done really just about everything in dentistry. I worked as an associate in private practice. I started a de novo private practice from the ground up, built it out, worked there for several years. My wife is a pharmacist and has a PhD in medicinal chemistry, and she wanted to move down to Austin, Texas, where things are a little nicer for her profession. So I agreed, why not Austin, Texas? Great. So I sold my practice, and she still had about 9 months left on her contract with the hospital. And she told me, take a sabbatical. And I was like, wow, that sounds cool. Do nothing for 9 months. And I tried it for about 3 days, and I really found out that it was just too boring. So I decided to go out and get a temporary part-time, just a loco tenants job while I was waiting. So I talked to a couple of my friends, and they said, look, dude, we don't want you to come in and work for 9 months. People fall in love with you and you leave. And I thought, okay, that makes sense. Let's go talk to the DSOs. Well, like some of you, I'd heard that DSOs weren't really a great place to be. That, in fact, one of my beloved mentors calls Aspen Dental the Great Satan. Okay, so when I came into my interview with the director, I set the stage very quickly and said, look, I've heard that you guys do everything from tell doctors how to practice to force us to do procedures. And if that's the case, you let me know now, I can save us an hour of time because I'm not doing any of that. She's like, Doc, I don't know what you're talking about. She's like, give us a chance, check it out. So I said, okay. I went and shadowed a dentist, and I found out he practiced exactly the way that I do, patient first, patient-centered, treat everyone like you would a beloved family member, and never ever do what's wrong, always do what's right. So I came on board as an associate 2 days a week, just thinking, I got 9 months, I'll spend a little time here. I ended up falling in love with it, and in about a month, he offered me the directorship of the clinic to become the managing clinical director and lead the place. And I resisted for a while because I still planned to move to Texas, but eventually I took the job. And I started talking to my wife, and I said, honey, you know, I kind of like this way of practicing. I like the patient base, would you mind if I tried it a little bit more? And she agreed. And the short version of that is I ended up falling in love with it, buying into the practice, starting to buy practices. And along about that time, I met Dr. Judge, and he said, look, I really would like to talk to you about a different role. I know you have a teaching background. I know you've mentored several doctors, brought them in and mentored them when they first came into the business. How would you feel about a role like that at the corporate level? And at first I said, well, why would I want to do that? Anyway, we talked it out. I told him I would give it a try, but if I didn't like it, I wanted to go back into ownership. And that was 3.5 years ago. I have never looked back. I really enjoy what I do. Until the pandemic struck, I ran a program called Edge. We bring about 30 to 50 doctors in every month for a week, spend time, get to know them, help them clinically, but mostly with the people part. Most of you are great clinically. Maybe 1% of the time somebody needs to be reminded to put adhesive in before putting in the resin, but for the most part, people are great. So anyway, that's me. Any questions you have about me personally, I'm happy to answer. Any questions about my specific time here, journey here, fine. But really, let's make it about you. I'll shut up and let you guys start asking questions. Miles, go ahead.
Great. Thank you, Dr. Helfer, for the warm introduction. I knew you were the right man for the job when I proposed this idea to you. So just want to thank all the students again for attending the Stony Brook Lunch and Learn Ask Me Anything session. And we're going to go ahead and jump into some of these questions. So Dr. Helfer, I know that you mentioned that when you were a student, you heard all these myths about the DSOs. When you started working with Aspen, what was probably the biggest perception that you heard that what you actually found out was a myth once you start working with us?
Yeah, that's a good question. So what I didn't tell you is that right out of school, I actually worked for another DSO for about 6 months. And during that time, the idea was I would work in a couple of their practices. I covered 2 back-to-back maternity leaves. And then I would look around. There were no practices open within reasonable driving distance from my home. And I would look around and see if something popped up. And so over the course of 6 months, I did very well there, but really no practice came about that was closer than 2.5 hours. So I ended up leaving them and going into private practice. But during that time, I actually had the exact experience that I mentioned with that DSO. They had hygienists who acted like operators, would come around and help you in your practice. And the first time it happened, I was a little surprised by it. She said, Doc, why aren't you taking out all these old amalgams and putting in white fillings? And I explained exactly why. Well, Doc, you know that under all those, so there was some kind of script they had to like lead me down the path. And so finally I started pulling up research and explaining why I wouldn't do that. And if it needed to be replaced, I would. But anyway, when I came to Aspen, I was very defensive, thinking I was going to run into the same thing. And that's why I had that conversation with my director, exactly that you would want me to take out old amalgams and replace them. And I don't want to do that if I don't have to, because I want to create sensitivity and all kinds of things where the doctor is in control of the treatment. That's the short version, that the doctor wouldn't be in control of their treatment. And she challenged me. She said, go check it out. And, so I went and shadowed a dentist, like I said, found out it was nothing like that here, which is very heartening. And I've been here for over 5 years now. And I'll tell you, I've never experienced anyone telling the dentist, in fact, it's part of our culture, the dentist dictates treatment. No one tells the dentist what to do. In fact, as a supporter, if you're one of my doctors, I'm never going to tell you, here's the treatment you have to do. If you ask me what I would do, I would say, well, here's what works in my hands. But that's a great thing about dentistry. There's art, there's science, there's practice, and we joke that if you put 3 dentists in the room, you'll get 6 different treatment plans, and sometimes I think it's more. But so those are some of the things I've heard, Miles, that someone was going to dictate treatment to me, which is just a big no-no in dentistry. It's so unethical, it's so wrong, and I promise you, I wouldn't stay here if it was like that. I'm just not going to accept that. And part of my role is just to make sure that my doctors are getting supported the right way, and that they're not experiencing that. And so that was my big one.
Great. Yeah, I hear a lot of things about clinical autonomy, right? And docs that join DSOs wanting clinical autonomy and wanting that freedom and autonomy over their own career to create their own treatment plan, right? So Yeah, I think that's great that you went in and you came in and you saw from day one you had that autonomy. You were able to create your own treatment plans, and it's a craft, right? It's a work of art, dentistry, and like you said, putting three different docs in a room, you get six different treatment plans, and that's what I'm hearing all around dentistry. So I think that's great. So one question for you, Doc, is what do you this you kind of touched upon this on your last answer about dentistry. What exactly do you enjoy the most about dentistry? Dentistry is a craft, it's an art. Every student and every current practicing doctor sees it a different way and have different skills and hone their craft a different way. What do you enjoy the most about it?
Wow, that's like saying how big is a circle? There are an infinite number of answers. I like being a general dentist because I do like the variety. I love oral surgery. I love extracting teeth. I don't like doing bilateral split, etc. But I do like taking out teeth, so that part's fun for me. So the great thing about being a generalist like me, if I want to do the fillings, I can. If I don't want to do the root canal, I can send it off to the endodontist. I think I love working with small things, and don't let the glasses fool you. They're readers. I actually have 28 visions. I have great eyes, and as a hobby, I like to polish opals, and so I cut gems and make jewelry as a hobby. So I'm constantly working with loops and things like that. So dentistry is just kind of an extension of that, working, doing hard tissue microsurgery and all those things are a lot of fun for me. The other piece, the part that I really dearly love, like in private practice, I thought the height, the pinnacle of this is be a cosmetic dentist. And really, we're all cosmetic dentists. And so I had a little bit of a high-end cosmetic practice, and I, would revel in waxing up my own teeth sometimes. And then I show the patient look, and they say, "Why are those little lines in there?" And I would explain, those lines have to be in there. No, I want it smooth. And then suddenly, you're looking at this chiclet waxed up thing. You're like, I'm not putting that in your mouth. So I found when I came to Aspen, my very first day, I delivered a denture to this little lady, and she hadn't really had teeth for years. And she broke down and she cried. And then I cried, and the lab tech cried. And it was just, she hugged me. It was this crazy feeling, right? And I don't know that I'd experienced that really before that, except maybe in dental school from time to time. I thought, wow, I love that. So I love helping people get the care that they need, starting them wherever they are today without judgment. Like, you're here now. Don't let the past be gone. Let's move forward. And I love it when they thank me. It feels like it's really fulfilling to help those people out.
Great. That's really inspiring. So on the other side of that token, what do you find most frustrating about dentistry, whether it was as a student or a professional practicing doc? Was there anything that I want to say kept you up at night behind dentistry?
Well, you're not supposed to say hygienist, so I won't say hygienist. So no, honestly, for me, the dentistry part's easy. Managing the team is always the hard part. In private practice, I had almost a dozen people on my team. Somebody was always late. Somebody always had a personal problem or needed to go to the doctor or do whatever. And I'm just like, fine, I get it, go do your thing. But I really didn't like that part very much. I think probably one of the things I liked about Aspen was I had a team, an operations team, an office manager, and then a regional manager. And I hate to say push all of that off onto them, but I only had to do the parts that I wanted to. So my office manager would handle all of that stuff for me, and I really, really liked it. So for me, the tough part, I think a lot of dentists find this, is managing the team and dealing with that part of it. Whoever asked that question, what do you find to be most challenging? I'm curious.
Yeah, I would be curious as well. So we have a question that came in regarding compensation. Without going into any numbers, just as from a general standpoint behind compensation, what does compensation look like here at Aspen when it comes to compensation and salary, and what benefits are there versus a private practice or associateship with a private practice? What's the difference?
That is once again one of those how big is a circle question. What most people don't realize is that every single practice in Aspen Dental is owned by a dentist. Aspen Dental Management Incorporated owns 0 practices. Consequently, the dentist sets their compensation plan. Now, based upon experience, we have a compensation plan that we recommend that they try, and many of them do, most of them do. Some will pay a little bit more, some a little bit differently. But what I have found is on balance, most of our associates make more than an associate in private practice. Most of our managing clinical directors can make, as I've seen them make double what an associate makes in private practice. You know, our owners that own 2 to 3 practices, the last numbers I saw on that, they're ranging between the $500,000 to $700,000 a year mark. So, like I said, without going too deep into numbers and how it all works, here's the thing I will say to you. And I saw a question about loan repayment. One of the things I'm always cautious about, let's face it, we're in competition with private practice. We're in competition with other DSOs. For you, you're a resource. We need great doctors. And if you're a great doctor, we want you to come here and try it out. And really, it's no risk. I mean, you come here, you get some training, you get to work on people, and we don't have a contract per se. If you decide today, I don't want to be here anymore, you could hypothetically walk out tomorrow, and there's no non-compete clause, but you could open up a practice across the street. Now, I prefer dentists give me, a little bit of a heads up, like we ask for 30 or 90 days. We're not going to fire them during that time period, but let us know so we have patient treatment continuity. But the bottom line is there's no risk here. If you don't like it, if the compensation isn't what you want it to be, you can go try something else. I will tell you, if you're a hard worker, you're going to make more here than you would if you're a hard worker in private practice. And I'm sure Miles can show you those numbers, or we have people who can dig in and get specific based upon the state that you're in. So without being too non-specific, I'll just say it can vary, but trust me, you'll do very well. And if you want to get into ownership, we have, in my opinion, the best ownership opportunity, and I've seen all of them. So it's really great to be able to get into a practice here and get as many as you can handle. So we have that opportunity for you too. Did I answer the question? I tend to meander, so pull me back in, Miles, if I didn't get it.
Yeah. I mean, that absolutely answered it. Thank you very much for that. And just to kind of piggyback on that point, and this transitions to our next question regarding path to ownership and career opportunities with Aspen. What does it look like? Because there's different levels, right? So you can be an associate, you can be a MCD, which is a lead doctor, and then you can obviously be an owner or a partner or whatever you want to be. So what does that look like, and how did that play a role in your personal career?
That's a good question. So, like I said before, I sold my practice and I was planning to go down to Texas and set up another one. When I came here and found out, it cost me a third of what it costs to open up a practice because of the deals that we have set up and the help we get doing that. I was pretty excited about that. But I guess, and you really kind of touched on all those points. I mean, as a career, I say come in as an associate, even if there's an MCD opportunity open, it makes more sense to come in as an associate as you can. Because to me, as a brand new dentist, my very first job right out of school was a temporary job for a week in a private practice, and the dentist had gone on vacation. So I had no mentorship, no clue what I was doing. The first day I walked in, there were 44 patients on the schedule. And the week before, I think I'd seen 2 a day. So it was very hard, and I didn't do very well. I'm just going to be honest. They cut the schedule in half and just had me see hygiene patients by the end of the week. I didn't know what I was doing in a real practice. So that mentorship is invaluable. So that's one of the things I think we shine at and do as well. You always hate to say better, but we definitely do it as well as anybody else. And I think we have a leg up in some ways in the personal mentorship game. It's important to us to make sure that you all have the support you need so that you don't feel like you're out there by yourself. So an associate, a managing clinical director, that's a person who would run a group of associates. to ownership, and then if an owner wants to have a partner, you can have partners that have anywhere from 1% to 49% of the business, however you want to structure it. There's great opportunity. There's also opportunity to move into roles like I have, for instance, at the corporate level, if you will. I work as part of a team that just ensures our 1,100 plus doctors around the country have everything that they need to be successful.
Great, Doc. It's like you're reading my mind here, because the next question was actually going to be about mentorship. And I think this is a big point to drive home with some of these students, because whatever level they're in, whether they're D1 to D4, that's one thing that's really, really important is the mentorship aspect for the next step in their career. So I'm gonna ask you about that. And I got a couple questions that I'm going to kind of bunch into one. So was mentorship important to you when you were a student? And if it was, how did that play into your role with Aspen?
Okay. Well, I think anybody who says that mentorship was not important to them as a student, I think that's disingenuous. I certainly knew nothing about being a dentist when I came to dental school, and without great mentors who really wanted to spend the time showing me what to do, I don't think I would have been successful. Yes, there are definitely dental school professors who thrive on the tears of their students, and I'm not talking about those people. I'm talking about, in my case, Dr. Lund was 80 years old, and we're in lab one day, and he lamented, young dentists don't really want to know anything about hand skills anymore. They just want to work with the handpiece. I wish somebody wanted to know how to use hand instrumentation. So I jumped at it. I said, Dr. Lund, I would love to learn that. So every day that I could get free, he would spend an hour or two with me and teach me hand instrumentation. So consequently, I'll use hand instruments, and people are saying, what's an enamel hatchet? What's that? But I can get things done in a very fine manner. I told you I like working with my hands at that level. So having different mentors and someone who fits you as your mentor, clearly you have to have that in dental school. But the other thing is you have to have that beyond dental school. Dental school is like anteing up in a poker game. Now you've passed your boards. You have met the minimum standard to get into the poker game. Now you really start to learn what happens when you're faced with 15 or 20 or 30 people on your schedule, and how do I get through my day? And to me, I think that's one of the most important things we're really good at teaching people. How do I manage multiple chairs, multiple patients? How do I get you from start to finish? At the end of the day, you don't feel like you've been beaten with a bag of rocks. You feel like, okay, I learned a lot, I took care of a bunch of people, and I can do this again. And just helping you grow in speed. In school, I had some pretty tough military professors who you could never show weakness. So you always had to act like you were smarter and better than you were. And it's not like that out in the world where I work. I know coming out, you probably can't do a crown prep in a half an hour. If you say you can, I'll come watch, I want to see it. But you can get there over time. It's just important that we don't fill your schedule with too many people and force you to go faster than you need to. We always have to be safe. So part of mentorship is figuring out where you are and then what your goals are and how to get you there. And that's realistically what it's all about.
Great. Thank you, Dr. Helfert, for providing your insight behind that. So let's shift gears a little bit here, and let's go into location and geography speaking. Coming out of dental school, did you end up working in a location or a state or a region where you wanted to, or did you have to move to start your professional career?
That's a good question. So my private practice was 3 minutes away from my house. So that worked out pretty well. When I decided to come work for Aspen Dental, the opening was about an hour drive away. So I ended up driving about an hour for a year. And then I started working at, looking for a place in that area. But in reality, there was an Aspen Dental office 5 minutes away from my home. If I had wanted to, I could have switched and transitioned there. So most of our practices tend to be in outlying suburban areas versus downtown. Now we are In Chicago, for instance, we're opening some downtown offices and we're working with that. But we just found geographically, if you're out in the suburbs, there are a couple of thousand people around there that you can, build a nice practice with. And there's some, I won't bore you with the numbers, but there's some population numbers and demographic numbers. We have a whole team full of people that work on setting up the locations. I tease them and I say, I think you just look for a Starbucks and a Target and you open up in the parking lot. But I think if they did that, that would work too. But we have a team, a real estate team whose whole job is figuring out where the next practice should be based upon practice flow. Also, as a doctor, if you've been around here for a while, you're experienced, you own a practice, and you say, hey, look, I want to open up a practice over here. We'll put the demographics team on it and research it. And if it makes sense, then absolutely go open one up over there. So there's a lot of opportunity geographically. The other piece that people don't always think about is everything's always for sale if you think about it in life. If you go to the dentist who owns a practice in New York with the right offer, he might sell it. So, you can obviously buy a practice from a dentist anywhere in the country who's willing to sell.
Great. Yeah. So regarding implants, so if a student wants to come in and have a question that they really want to do implants, is that something that they're able to do here with Aspen?
Yeah, absolutely. I mean, we're on a cutting edge of many things like that. We have a Dr. Sundeep Rawal, R-A-W-A-L, Sundeep, S-U-N-D-E-E-P. Dr. Rawal joined our team last year, and he's a prosthodontist and it's fantastic with implants. He owned a couple of implantology centers down in Florida. So he has a training course that all of our doctors go through, beginning with how to restore implants and moving all the way up through replacing implants, complex attachments, how to teach others to do it. Really, if you want, you can do just about anything that you want to with implants here. We are also talking with a university, not to be named at the moment, about setting up a school inside of their school. So on the weekends, we would use their facilities and teach implantology. Sometimes doctors want a little more help with surgery, that sort of thing. So all kinds of continuing education, live and online, to help with that. And the implantology path, day one, you can start, learning how to place implants, how to restore implants, you name it.
Great. Thank you, Doc, for that. One question I have, and this is something that I hear from a lot of the students or even other docs, even current practicing docs, regarding production goals. Is that something you can expect when you join Aspen? Are there any production goals, and did you have any as you were a practicing doc with us?
So there's no real production goal per se. I mean, we want you to be busy and see patients. As the owner of a practice, just like in private practice, you have to pay bills. And so you know what your budget is, like how much it's going to take to pay the bills for the month. And we have a team that helps us figure all that out. And then you can figure out realistically like what you can do to meet that, to go above and beyond that based upon your personal goals. And so that's dentist dependent, and you control your schedule. And, obviously we've got to keep the lights on. So just like private practice, you have to do enough work to keep the lights on. But I'll tell you, it's pretty easy. Nobody's going to be pushing you and saying you must produce this amount. What do you want to do? What are your goals? I mean, a lot of you have student loans, probably most of you. I assume you'd like to pay them back sooner rather than later. So we can show you how to meet financial goals. But really, to me, what I care about most is that you put the patient first and always do what's right by the patient. Never overtreat. Never undertreat. I mean, tell patients what they need, comprehensively treatment plan them. And if you do that, I'll be very happy.
Great. So another question is that actually just came in is, so do DSOs provide dentists with their preferred instruments that they want to use, or do dentists need to work with what's available?
That's a good question. So there are lots of different DSOs, so I can't speak to what all of them do, but if you need a forceps, we'll order the forceps for you. I mean, it just depends upon what you're talking about. I've never had anybody tell me, no, I couldn't have something that I needed. We've done a lot of research on what's effective in terms of, say, CNC to make crowns in the office, or, we have like tarot scanners in our offices, whatever. But if there's something that you want, we'll get it for you. So now, if you want 3 lasers, I'm probably going to say, Doc, you probably only need 1 laser. So, it just depends upon what we're talking about. But for the most part, I've never seen a problem with, realistic stuff.
Great, great. One question for you, Doc, would be regarding your schedule. So as an associate or as an MCD, and you can kind of go into the difference behind both schedules. What was your schedule typically like as an MCD, and how does that differ from a new grad coming in as an associate?
That is a great question. So I'm not good at the toot your own horn part that they say I'm supposed to be good at. So forgive me. I'm very fast. In dental school, I realized I had to be clinically excellent and I had to have speed. So I would go by ivory and teeth and cut them as fast as I could just to get fast with a crown prep. So literally I can do my part of prepping a crown in 5 to 10 minutes most of the time. And you would look at it and go, that would pass the board. And so you don't have to get there, but we all have our difference of bell curve. I'm very quick with oral surgery. So consequently, my average day, I might have 40 people on my books, but that once again, I was in one of the top 10 practices in the country, and we have 800 plus practices. So not everybody's going to be at that place in the bell curve. What's important is to figure out what works for you, especially as a brand new grad coming around to the school. Nobody's going to expect you to be able to do that. In fact, if you say you can, we're probably going to say, are you sure, Doc? We're going to sit down with you and say, how much time do you want for a crown prep? How much time do you want for a single posterior 3-surface filling? And just get a feel for that so that when somebody calls in to schedule an appointment, they can look at it and go, okay, Doc needs an hour and a half for the crown prep, or an hour, or whatever it is. So I wouldn't try to compare yourself to someone who's been doing it for a few years. Trust me, the speed, you're going to get faster anyway. It's just part of it. You're going to be efficient. Just always be safe. Always, do what's best for the patient. Never take risks in the name of going fast, and we'll figure out the schedule part for you. We're very good at that.
Yeah, that's one thing that I typically get from students is, what's my schedule going to look like? How many patients am I helping a day? What if I'm not comfortable with something? Will I have another doc in the office that I'll be able to maybe refer something out to, or can actually be as close as chair side with me to help me with a specific case? So I think that's really, really important point to drive home with some of the students, is that we absolutely offer the support that you need. And it's not a race when you're working with patients. We want you to work at the pace that you can work at, and we give you the full support and autonomy. So my next question is, what resources and training programs does Aspen Dental offer to just ensure that a new grad coming out has a smooth transition when they start with us?
That's a great question. As Miles mentioned earlier, we have lots of free CE for you guys, so definitely take advantage of that. We currently, because of the pandemic, we're doing everything virtual right now. So currently, your first day in, you'll be sitting in a virtual classroom for 3 days, working with myself, the other 2 clinical directors, and part of the learning and development team, just going through a new doctor experience Aspen, and learn exactly what to expect in your mentorship program. Once you finish with that 3-day program, you're going to enter into a month of in-clinic mentorship in a state where you can work, and you're going to observe a dentist, and then you're going to be working on patients. And by the end of that period of time, we'd like to get you to a place where you can handle a column a day of dentistry as an associate. And you should be able to do that. Like I said, we're pretty good at helping you get through that. If not, sometimes we extend that training if people need it, because ultimately it's about getting you what you need, not forcing you into a cookie cutter. Some people are faster than that, and they're like, come on, but you got to stick around for the 4 full weeks. And we owe it to the patients to just make sure that the doctors we're seeing are safe and good practitioners are. So part of that evaluation, you'll be working with your mentor. You'll be discovering your strengths. You'll be discovering opportunities that you have. You may agree or disagree with them, but you should talk through that. And then someone like myself, or if you're going into an office with a local owner, they'll talk with you and continue your mentorship after that. So after your 4-week training, you go to an office, you'll be working with either a local owner, myself, other mentorship to make sure you have everything that you need. And then at about the 3-month mark, we have a Beyond the Chair program. You, once again, will come virtually. I wish we could do it in Chicago like we used to. We come in and we get to have dinner and maybe an adult beverage and talk about exactly this kind of stuff, like sit down and answer questions, like what's really going to happen, what's it really look like. But for now, we'll be doing that virtually as well. We'll dig a little bit more into what you've seen in the first 3 months. How'd you like doing dentures? How, crown and bridge, how's everything going? We'll talk about treatment planning, because in group practices, it's important to calibrate on treatment planning so that, dentists treatment plan differently. You want to try to be, calibrated as much as you can, or know what you do, that kind of thing. So beyond that, we have advanced individual training. If you want to get into ownership, if you want to be a mentor, we have training for mentors, we have training for ownership. So a vast array of programs that are available and constantly growing. So I promise you we have as much or more training than anybody else out there.
Great. Thank you, Doc. You mentioned in your last answer about COVID and the mentorship aspect of it. So we're doing everything virtual. So let's kind of shift gears a little bit and transition to the clinical side of it. So what changes are we making now opposed to pre-COVID when we are seeing patients regarding social distancing and scheduling and the correct face mask that a doctor has to use, and what are some of the transitions that we're making now?
Well, so every state's a little bit different and every practice is a little bit different, but just like before, we practiced universal precautions, and now we're practicing universal precautions plus. We take temperatures when people come in. We have limited number of people in the lobby, one patient in at a time, just adapting like everybody else in the dental and the medical world is to COVID. And, the doctors, have, some of them want to wear an additional screen. I saw one the other day that was great, like this whole body harness that fit over the top of the guy's head, looked like a spacesuit, whatever, like whatever you need to do to be comfortable and feel safe, you can do. But we do have minimum universal precautions and the additional stuff. Since COVID, you're probably experiencing the same thing in clinics now.
Great. So I know that we touched upon compensation a few questions back. What about some of the benefits and health insurance that Aspen offers for a dentist? What does that look like, Dr. Helfer?
Oh, that's a good question. I'm not the right person to answer this question because I honestly don't know how it works in every practice. Once again, each practice is owned by a dentist, so it's different. Aspen Dental doesn't provide your benefits, but most dentists do. We do have plans that you can get in. And like most employers everywhere in the world, whether you're in the auto business or whether you're in the dental business, you end up paying a little bit. The company ends up paying a little bit. That's just the way health insurance works. Before I became a dentist, I used to own an insurance agency, so I know a lot about insurance. So you're probably going to pay some. There are all kinds of benefits. You have options for disability insurance, which is, depending upon the source you read, probably the most important insurance for someone just coming out of dental school in their mid-20s. The chance that you'll be disabled before age 65 is 3 to 5 times more likely than that you will die. So we have life insurance available, all the benefits you can imagine. 401ks are out there, all kinds of different things. But I really want to, that's an HR question, so I don't want to go too far down the rabbit hole and tell you the wrong thing.
Absolutely. So let's dive into some questions regarding procedures. I know that you mentioned the whole implant process and how we play a big role in that. So someone just asked, how long does it take for the lab? Say a process of a crown or a denture to be finished. And what does that look like? Do we have an in-house lab? Send it out? What does that process consist of?
Good question. So currently, you as a dentist, you can use any lab that you want to. Years ago, we noticed some of the smaller labs around the country. Well, there was a case in which a small lab took essentially a bunch of amalgam and fashioned a crown out of it and sold it as basically a crown. And luckily, the dentist found out before placing it in the patient's mouth. It just didn't look right. So we decided, and Christian LeBrun, who's one of our lab guys, decided to put together a program with the FDA. And as far as I know, we're the only ones that do that. We require labs to go through an FDA screening process before we will call them a quote unquote approved laboratory. And they're our partners. Only about 6% of labs in the country can pass that process. It's just crazy to me that if a lab, for instance, made a crown and it wasn't what they said it was, there's no law that binds them to that. You as a dentist place that crown, you're now 100% responsible for that. So we use labs both across the ocean and here in the United States, and they all do a great job. The time that it takes, on average, it takes about 10 to 12 days to get a crown back. We've done a lot of research on, does that matter to patients? Do they care if they have a crown in 3 days or if they wear a temp? And by and large, people don't really mind that as long as they're not experiencing pain, so make them a great temp. Dentures are a different story altogether. We do have in-house denture laboratories, and every practice has one. So you have a lab tech in every practice. And I've gone to my lab tech and said, hey, Joe's got a wedding tomorrow. Can we make a denture for him today? And we've fabricated a denture in a day. I don't want to do that every day because that messes up the schedule and it can, really, really be hard. But as we're moving into 3D printing of dentures and digital dentistry, I suspect that'll be becoming a lot quicker. Like, I won't be shocked in the testing we're doing and seeing dentures coming out of the lab in an hour. So, it's just getting faster and faster and getting better and better. So I think you'll be pretty happy when you see what we can do.
Great. Thank you, Doctor. So we're going to wrap this up in a couple minutes, 12:45, so we can have the students resume classes at 1 p.m. We want to give them some time to transition to that. So this is the last question for you, Doctor. What is, and I think this is a great note to end on because you're currently speaking to the students of Stony Brook. What is your biggest advice for the students, no matter what class they're in, whether they're D1, D2, D3, or D4? What is the biggest piece of advice you can give them and what you found most helpful during dental school and then transitioning to your professional career?
Wow, that is a big question. I think for me, where I see dentists struggle, they're great clinically, but they forget that there's a human being attached to it too. So while you're working to become a fantastic clinician, also work to be a great human being. Be a real human being with another real human being. Take time to explain to people what you're doing. Just explain the next step. Try not to use big dental words with people. I know the professors have to be impressed with us, but the people don't know what you're talking about. So slow it down a little bit, make it easy for them to understand, and a lot more people say yes to you. I don't care if you have the most anointed hands in the world and you're the best dentist in the world. If people don't hear you and they won't accept your treatment, you don't get the practice. So be good to people and, always work to get your speed up in the lab and practice. I mean, there's so many things I could give you, but ultimately it's about being a real human being and providing a service to another human being.
I think this will be a great time to conclude. Just want to thank Dr. Helford again for joining on. You were amazing. You answered amazing questions. I want to thank the students again for asking the questions live and beforehand. Like Dr. Helford said, please reach out if you have any questions. You all have my email when you signed up. So if you have any questions for me or if you have any questions for Dr. Helford, please feel free to reach out. And I just want to thank you all for attending. Good luck on the rest of your school day, and Thanks again. Thank you again, Dr. Helfer. Really, really appreciate it.
Anytime, Miles. Have a great one, everyone. Hope it was
All
helpful.
right.
Have a good
Bye.
day.